15 surprising things that can raise your blood pressure. Although there are foods that can trigger a rise in blood pressure, a diet rich in fruits and vegetables will be beneficial in controlling these blood pressure levels. Blood pressure is the force with which our blood is pumped through our body. Although it is always constantly changing, there may be increases known as hypertension. When the blood pressure values exceed 140 millimeters of mercury and 90 millimeters of mercury, it is hypertension. If you need to control hypertension or prevent high blood pressure, we are going to share with you the 15 surprising things that can raise your blood pressure. Number 1. Lack of enough potassium. Foods that are very high in potassium play a crucial role in managing high blood pressure because potassium reduces the effects of sodium in the body. The more potassium you take in, the more sodium you lose through your urine. The kidney needs to maintain a reasonable balance between the potassium and sodium content to keep the right amount of fluids in your body system. Table salt is a typical supplement of sodium. The high sodium content in the body can lead to increased blood pressure, which may finally result in hypertension. Even if you're eating foods that contain a low amount of salts, you can still experience increased blood pressure if you don't add enough potassium supplements to your diet. Do you find this video interesting so far? Please don't forget to subscribe to my channel. Hit the like button and ring the notification bell if you want to see more content like this. Number 2. Antidepressants. Antidepressant works by changing the body's response to the brain's chemical like serotonin and dopamine that affect your mood. These chemicals are known to cause an increase in blood pressure. If you're taking antidepressants, you should check your blood pressure regularly. If your blood pressure is increasing uncontrollably, ask your doctor for alternatives for these medications. Number 3. Loneliness. According to a 5-year study conducted by the University of Chicago, being lonely can do more harm to the body than just its mental capabilities. Feeling lonely not only lowers your happiness and confidence, but can also raise your stress levels and blood pressure. The study showed a direct correlation between high blood pressure and loneliness in people over 50 years. Signs of increased blood pressure began to appear after the second year and increased slowly over the next 3 years. When you have a circle close to family and friends as you get older, you feel more relaxed and your stress and pressure ease up. Number 4. Pain. Pain acts as a warning alert to your body. It tells you that something is wrong and your body moves in response to it. Your nervous system goes into high drive and secretes chemicals that cause your heart to beat faster and your arteries to constrict. You also have a product of stress hormone cortisol in your body, and all these processes can spike up your blood pressure. Interestingly, temporary pains cause an increase in blood pressure but do not eventually lead to hypertension. Once the pain goes back, your blood pressure comes back to normal. Number 5. Dehydration. Dehydration occurs when you do not have sufficient water in your body. Not drinking enough water or losing more water than you can replace can also result in dehydration. Dehydration has been connected to an increase in blood pressure. Although more investigation is needed, it's worth knowing that dehydration can spike up your blood pressure through the action of the vasopressin hormone. Vasopressin is produced in your body when there are many solutes like sodium levels in the body or when your blood volume is deficient. These only happen when you're dehydrated and there are not enough fluids in your body. When there's a high secretion of vasopressin, your blood vessels increase, which can lead to an increase in high blood pressure. Number 6. Birth control. The birth control pill is the number 1 method of controlling births used by women. Birth control pills are made from progestin and estrogen. These hormones make the pills work to prevent pregnancy, but unfortunately they can also increase your risk of developing high blood pressure. While taking the pills, you may also experience a small increased risk of developing a blood clot. If your blood pressure increases abnormally while using the pill, it's advisable to switch to another birth control method. However, not all women can have increased blood pressure from using birth control pills, but if you're worried, do have your blood pressure checked at least every 5 to 11 months. Number 7. Thyroid problems. One of the lesser known causes of high blood pressure may be something you are dealing with right now and don't even realize. According to a study published in the journal Hypertension, there is a correlation between hypothyroidism and high blood pressure. Patients with a thyroid gland that does not produce enough thyroid hormone had significantly higher blood pressure readings than those who did not suffer from this problem. Also, hyperthyroidism can result in blood pressure readings above normal when too much hormone is produced. Hyperparathyroidism is a type of thyroid problem that can be responsible for higher blood pressure as well. This condition affects hormone regulation and can result in excess calcium in the blood, which elevates blood pressure levels. Number 8. Herbal supplements. Because herbal supplements are natural does not necessarily mean that they are safe. Remember to let your healthcare provider know about any herbal supplement you take, or may want to see if the supplement could raise your blood pressure or tamper with your blood pressure medications. Examples of herbal supplements that can affect your blood pressure medication or increase your blood pressure include arnica, licorice, ginseng, and guarana. You should avoid supplements that raise your blood pressure. Number 9. Sleep apnea. Another astonishing thing that causes high blood pressure is sleep apnea. Many people who suffer from this disorder often let it go undiagnosed, so it can lead to restless nights, snoring, and eventually high blood pressure. According to studies by the National Sleep Foundation, when breathing is interrupted during sleep, oxygen levels in the body drop. The brain sends signals through the nervous system to increase the flow of oxygen to the brain and heart, constricting blood vessels. These frequent drops in blood oxygen levels can trigger the release of stress hormones, which in turn begin to raise your heart rate and increase your overall risk of developing high blood pressure. Talk to a doctor about the various treatments available to help you get a more restful night's sleep. Number 10. Too much sugar. Most people are aware that too much sugar can add inches to their waistline, but they don't realize that sugar can cause high blood pressure. Many healthcare professionals now believe that sugar is more dangerous to the body than salt, and conclude that they need to reduce sugar in their diets to treat patients suffering from high blood pressure. Fructose, sugar added to processed drinks and foods, seems to be the leading player in developing hypertension. According to the American Heart Association, adults should not eat more than 6 teaspoons of sugar a day. To put this in perspective, a 450 milliliter soda can contains 9 teaspoons of added sugar. To reduce your intake of sugars, you must limit processed foods in your diet. Number 11. Alcohol. Irresponsible drinking of alcohol can spike up your blood pressure. If you have a high blood pressure problem, your doctors recommend avoiding alcohol. Any excessive consumption will have severe consequences on health. Reducing alcohol intake can help lower the risk of having hypertension in people with normal blood pressure. Alcohol can hinder any high blood pressure medication that you may be taking from working effectively because of the interaction of alcohol with the drugs. Moreover, many alcoholic drinks are very high in calories and sugar. Therefore, drinking alcohol can contribute to overweight and obesity, increasing the risk of having high blood pressure. If you find it difficult to cut back on drinking alcohol, you can talk to your doctor for advice. To avoid high blood pressure, doctors suggest avoiding alcohol. Any excessive consumption will have severe consequences on health. Number 12. Decongestants. The flu or cold puts a strain on the cardiovascular system. Both decongestants and non-steroidal pain relievers, which are part of many over-the-counter cold medicines, can also raise blood pressure. This is what experts from the American Heart Association point out. The decongestants, pseudoephedrine or phenylephrine, for example, cause blood vessels to constrict. As a result, there is less fluid in the sinuses and the common cold symptoms improve. However, such vasoconstriction is unfavorable in people with high blood pressure or heart problems. Caution should be exercised, especially in people who have had a heart attack, stroke, or heart failure due to high blood pressure. People with immoderate high blood pressure or heart disease should avoid taking oral decongestants. Anyone with high blood pressure or heart problems should seek advice from a doctor or pharmacist. If the symptoms are not too severe, rest and plenty of drinking water will help. Of course, it's best not to get infected in the first place. A flu shot, adequate sleep, and frequent hand washing help here. Number 13. NSAIDs. Non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, and the COX-2 inhibitor celecoxib are among the most widely prescribed and used drugs globally. Both classes of drugs are known to cause side effects such as increased blood pressure. Even small increases in blood pressure can increase the risk of cardiovascular diseases and associated mortality. A current study shows that ibuprofen has a significantly less favorable effect than naproxen and celecoxib. Number 14. Coffee. Drinking too much coffee is very bad for your blood pressure, but experts don't recommend banning it altogether. After drinking coffee, measure your blood pressure to get a feel for how the drink is affecting your blood pressure. If the blood pressure rises significantly, talk to your doctor about whether and what amounts of coffee are safe for you. Ask if coffee might hurt the medication you're taking. You have to consume it in moderation or even turn to decaffeinated products. Number 15. Age. As you grow old, your vascular system changes, and these include your blood and heart vessels. In the blood vessels, there's a sharp decrease in elastic tissue in your arteries, making them less compliant and stiffer, thereby increasing your blood pressure. Be careful of the things you do, and they can have a significant impact on your blood pressure. Foods high in saturated fats, sugar, and salts, and some activities like drinking alcohol can increase blood pressure and damage your heart health. By avoiding these things, you can keep your blood pressure at a moderate level and live healthily. Also, do not forget that simple habits, such as maintaining a healthy body weight in overweight people, regular exercise or sporting activity, and a balanced diet are essential tools for positively influencing blood pressure. Did you find this video helpful or informative? Let us know in the comments section below. Make sure to subscribe so you don't miss out on my future videos. Don't forget to like and share. Stay healthy!